Good afternoon, everyone. Welcome back to Failing is Not an Option, where we are all things marriage and family therapy, but not just for the MFT exam, also how we are going to be studying these theories, these questions, and also paying attention to how we can apply our knowledge to how we work with our clients, whether if it be your families, your couples, or some of those individual clients that you may have. Today, we are going to be talking about couples therapy and also how we are going to understand these questions and how we navigate these questions so that we are able to find the best answer. Now, some of your couples therapy theory questions are going to be along the lines of what you see here. There are some models that will not most likely have a question that involves a couple versus these that you see before you. So like Bowen, structural strategic, of course, emotionally focused therapy, that's your couples therapy model, but some of your behavioral models as well will also like apply it to couples. Now, I learned that by reading I believe it was Eli Karam's book. Gottman Theory is in the behavioral theory section. And then I had to look and I'm just like, well, why? Like, why is Gottman Theory there and not just a part of its own model? But then it's like it's a theory that they discuss. So Gottman's theory is also one of your couples therapy theories that we work on, and you will also need to know how to navigate some of those questions. I don't know if Gottman therapy is really weighed heavily on the national. I can't remember. Maybe it's weighed heavily more on California, but whatever the case may be, we are going to talk about that as well. So these are some of your common themes that you are going to see when it comes to couples therapy questions. And I learned about a lot of this just by studying all of the questions and things that I've been studying. So of course, your reframing, your enactments. Enactments are a part of structural as well as emotionally focused therapy. Your communication skills, of course, triangulations, huge one when it comes to Bowen, when you know those parents, and even structural and strategic as well, when those parents got the conflict going on and they're drawing in that third person, which is mainly going to be that kid. They're going to be drawing into the conflict that they have. Attachment patterns. Your ethical and cultural considerations is huge when it comes to couples therapy. You want to pay close attention to if that couple is from different backgrounds, different spiritualities, so that you're able to understand and navigate that this is a cultural question and I need to be curious as I am answering this question. Confidentiality, cultural sensitivity, and mandated reporting is also a huge thing when it comes to couples therapy. You have to make sure that what it is that I'm possibly speaking about, if I'm meeting with this client individually, I can't like tell it to the other client when you are working with them together as the couple. So that is along the lines of your no secrets policy. And I know a lot of people kind of struggle with those questions when it comes to the no secrets policies. Should we just assume that there's a no secrets policy or no? I have yet to come across a question that does not assume that there's a no secrets policy than to assume that, well, they didn't mention it, so it can't be one. Just assume that it is one, because when it comes to couples therapy, you can't have one of the clients telling you, I cheated on my wife or my husband 2 weeks ago, but I don't want my wife or my husband to know about it. The therapist cannot hold on to that. I get it. We do have confidentiality. That's why you kind of like tell the client like, hey, can you be transparent? Can you please let them know that this is occurring? And if they're not going to be able to tell them that, that they are having an affair, but that there is an affair, it kind of causes difficulty with working with that couple, because now I have this secret. I know what's going on. It's going to disrupt this relationship that you have with the couple because the couple is considered the client. It's kind of hard when you do that. So confidentiality is like a huge piece as well when it comes to couples therapy. Now, we are going to talk about some of the interventions that come along the different theories and how you should like look for them, the type of interventions that should be applied when it comes to certain couples therapies that you will see within those questions. One of the first one is going to be that communications and an interaction piece when it comes to interventions. That is your active listening, your communication, those I statements that you might see come up in the questions. Have the couple work on I statements for doing this when they're arguing with each other. Role playing, that's your enactments that we were talking about, especially during some of those difficult conversations that couple might be having. You might ask them, okay, well, role play to me what happened last night. Show it to me so that therapist can observe some of those communications and work on some of those interactions that couple might be having. That usually occurs in what? Structural family therapy and emotionally focused therapy. Timeouts for conflict de-escalation. This is more along the lines of Gottman's theory, because I know in one of his I think it's one of the four horsemen where he talks about it, but then there's an antidote for the four horsemen. I talk about this in my Gottman theory video, so if you want to revert back to that video, I will put that link so that you have an understanding to it. But Gottman talks about the four horsemen, and there are antidotes to the four horsemen, and one of them is taking a time out, walking away, just in case, if the temper starts to rise, you take a break, and then you come back and you discuss it. This is how you are going to work through some of those communication difficulties that those couples might struggle with. These would be the interventions that you would use. Emotion focused intervention. This is your coaching. This is your I'm hearing what you're saying, let me validate your feelings, and let's do this. Again, your enactments, the role playing. I need to see in session some of those emotional expressions that you are going through at home so that the therapist can better help you with that. Remember, EFT draws from that attachment based theory. So, of course, we're going to be talking about some of those attachment needs that has been unmet, that is also causing some of the lack of communication or the negative communication that is going on within that couple. And then again, we work on restructuring some of those emotional responses and interactions by exploring those core emotions that sometimes, we can't actually see. So these are more of your emotion focused interventions that could possibly be used in emotionally focused therapy. Your structural and strategic interventions when working with couples is going to be reframing some of those conflicts. We have to look at these negative interactions that we are having in a more positive light so that we can reduce some of that blame of why these negative interactions are occurring in the first place. Right? We have to know our roles. We have to be familiar with our hierarchies within the family so we know who's where and who belongs where, right? Your directives is also going to be a huge intervention that is going to be used in strategic. And we just talked about this last night about those couples that go home and they're just arguing with each other all the time. Okay, well, I'm going to direct you to do this paradoxical intervention. Go home and argue for 5 minutes. Only 5 minutes, and it must be playful and it must be silly. Right? We also talked about unbalancing last night. That therapist is going to support one of the partners temporarily in order to make a shift to get some balance back into the family. And then again, we just talked about some of those paradoxical interventions last night as well. That is what a strategic therapist would do with a couple. Now, if remember last night, we also discussed strategic therapy kind of draws on structural. So as you see, unbalancing is also one of those. You would do that with both structural and strategic therapy to work with the couple. Your Bowen and your family systems intervention. This is your genogram. We're going to be mapping some of that family history, trying to see where are some of these patterns coming from and if they're being passed down now to the couple that is sitting in front of you, right? Your differentiation of self. Even if we are going to be so close with each other and connected, we are still individuals and we should have autonomy for each of us, right? Again, that triangulation is a huge piece. We have to reduce that triangulation by removing that third party that is involved in that conflict. Because that third party that is involved in a conflict, it's not reducing a conflict, it's only stabilizing it. So now we have to detriangulate, right? And Bowen he's the coach, so he's going to coach on some of that, managing that anxiety. So at some point when you have all these emotional cutoffs and maybe with your family, or even if the husband and the wife are kind of emotionally distancing themselves from one another, we got to work on that and manage that so that we can repair that. These are some of your interventions for the Bowen and family family systems theory. Now, your behavior and your cognitive behavior intervention is going to be based on using some of those behavioral experiments. We need to test some of these new ways of interactions in order to see if they work. And if they don't work, okay, then we need to try something new, right? Challenging those distorted thoughts about the partner, that negative way of thinking that you may have, problem solving training, the contingency contracts where you're going to sign this agreement. Hey, I'm going to work on some of my behaviors, right? And there it is, that behavior exchange, that quid pro quo, right? Reinforcement of some of those positive behaviors. And Gottman talks a lot about that, his emotional bank account, the giving and receiving and everything. Watch my Gottman video. I go into in-depth more about the behavioral exchange theory within his theory. And then I think I can also do one for behavioral exchange theory as well. I can definitely do that. But these are your behavioral and cognitive behavior interventions. That was all of the couples therapy theories and how you would see and recognize some of those interventions if you were to notice it on the exam or even with your mock question. The thing about it is, we need a strategy for how we navigate these questions. So let's talk strategy on how we're going to come up with the best answers to finding the best answer when it comes to these questions. You are always, this is not just for a couples therapy question. You're always going to look for key details. Who's the client? What's the problem? And what is the therapist doing or considering doing in any question, not just your couples therapy question. Reading the question carefully is crucial, because I have noticed that some people kind of like miss certain words or terms or context when it comes to first, next, best response, most appropriate response, next best step. And you have to pay attention to that. That is always going to lead you to your best answer and how you are going to navigate some of those answer responses. Pay attention to some of those words. Least likely and accept. Some of those can be tricky if you don't have a handle on how you answer those questions. Least likely is what you are most likely not going to do. Accept means it has to be something wrong. Accept is also like, okay, you would do this, but you won't do this. That's how you can reframe some of those questions so that it doesn't sound so difficult to navigate. Just like not, which one would you not do? This is something that is wrong. This is something that you are most likely not supposed to be doing. It can trap you if you do not know how to navigate those type of questions. So you need to read the question carefully so that you even know what that question is asking you. Always pay attention to the theory or the approach that is being mentioned in the question. Sometimes that question is not going to say, what would a Bowenian therapist do? Or a strategic therapist would do what next? It's your job to know those key terms, those synonyms, those words, those phrases that match that model so you can identify it as quickly as you possibly can so you know which answer response you need to look for. Some of those words up there are just generalized key terms based on each of those models when it comes to couples therapy. You know how Bowen is, EFT, what you're looking for, structural, and CBT. Certain words match certain models. Be familiar with it. Recognizing some of these underlying theories in these words and these phrases will help you narrow down your options much more quicker, leaving you with much more time to get through the rest of the questions and having time to go back to look at questions that you may have flagged or you felt that you were really unsure about the answer. Now, here is one of the biggest things that you need to do. You need to understand the intervention and categorize it. Is it communication? Is it behavioral? Is it emotional, solution focused, or structural? Those are just some examples. You need to know which theory intervention they are talking about so that you can find your best answer as quickly as possible. Identifying the interventions or choosing the next best step will help you match it to the knowledge of the theory that the question is talking about. It is crucial that you know your key terms, words, phrases that matches that theory. One of the other biggest thing is you need to know your phases of therapy. Which phase is this question in? By paying attention to some of the words and the key terms that they are using. You know that if that vignette is talking about interventions, you're most likely going to be in the middle phase of therapy. If it's talking about rapport, psychoeducation is an intervention, but it's using CBT as an early intervention. You have to know conflict resolution, skill building, enactments, assigning homework assignments, middle phase. Your late phase is going to be what? Making sure that your client, the couple, whatever the case may be, is not going to relapse and fall back into those old ways, maintenance of what they've worked on, progress in what they have made, so that you are able to tell that you are in the late phase of therapy. Some questions are going to ask you, what do you do first? What do you do next? You need to be paying attention to those common words that are in the question so you know how to find the best answer. Process of elimination is your best friend. However, process of elimination can make you or break you if you are not confident or knowledge in what word, what phrases, what terms matches what theory. You must know this. Eliminate the answers that you know it has nothing to do with what's going on in the vignette or what's going on with those couples presenting problem. Eliminate answers that do not align with the theoretical approach that is being discussed in the question. That is where it becomes tricky. If you do not know what theoretical approach is being discussed, your process of elimination can make you or break you. Anything that is unethical or unsafe, and you know for a fact that answer response is bonkers and it's like, this is crazy, I know I can never do this, you are going to eliminate it immediately. Once you get down to your final two, which most likely we all are going to come down to our final two, I still, when I see a question that someone sends me and they ask me what I think about it, I'm like, okay, Carrie, I got it down to the final two. Which one of these final ones is going to be the best answer that is most effective and is going to be theory consistent? That's why I am really big on knowing these synonyms. This exam is going to draw words, phrases, terms from every nook and cranny of the internet. You have to know which key terms matches what. That's why even today you saw me with the strategic key terms. It's best for you to know them and become familiarized with each and every one of them, better than to just study the ones that are most likely. I want you to be prepared. So even those answer responses, you're going to know which ones in the answer response to eliminate. Ethical or cultural cues when it comes to couples is very crucial. There are some interventions that you may think as a therapist is going to work, but you need to consider the cultural context before doing so. You cannot just simply say this is what you would do and you would think that this couple is going to do it if they are from a different culture. You cannot do that. Most couples questions when it comes to different ethnicities and different cultures, especially in even spirituality and religion and stuff, it requires you to be curious. So do not pick an answer response where it has you solely choosing how and you should and what you need to be doing with this client. Be curious when it comes to cultural questions, especially with couples. Mandated reporting, confidentiality, and informed consent. These are some of your ethical flags that you need to be paying attention to. There's a lot of questions that we've come across that says there's the husband and the wife, but then I think that either the husband or the wife has revealed to you in like an individual session that they wanted to kill themselves. Can you break confidentiality? Yes, you do. Depending on how that question is worded and if that client has a plan, then yes, you would have to let the other partner know that this is what's going on. Informed consent is crucial. You go through that in informed consent about your no secrets policy. This is what we talked about. Confidentiality when it comes to couples and families is a huge risk because you have to be careful with how you are going to manage it. Some of the questions are going to be testing your clinical judgment and how you are going to be ethically aware of how to work with this couple. Now, some of the couple's questions, just like I discussed, they can be worded differently. Now, there was this one question that was like, worked with them individually or something, but then it was like something from a family. And I'm like, that doesn't make any sense. Like, I'm working with the couple, but what are they talking about? Pay attention to how the wording is, especially when they say they work with the couple, but then secretly such and such told them this. Did they pull them to the side and tell them that? Were they working individually with them when they secretly told them this? Pay attention to how the wording is in a question, and we'll do some questions so that we are able to navigate them and work on them together. So the thing about it is, this is not just for couples questions. This is for all of your questions. Do not overthink. It is your greatest enemy. The simplest answer is going to align with the theory, the stage of the therapy, and what the client needs. That is what you need to be looking for. Don't go adding stuff to the vignette. Don't go over complicating scenarios with, adding extra stuff to it. Now you're causing yourself to make assumptions. Well, it didn't say this. If it didn't say it, it's not there. Whatever is in that question, that is what you have to work with. Please do not try to apply some of these questions to what you would do in a real life application. Sometimes the answers that you choose might be incorrect based on those exam writers' answers that they are choosing for that question. Make sure that you are always going to be paying attention to the pattern of the questions. Once you have multiple questions that you've done that is along the lines of kind of like the same kind of question, and you've gotten that pattern down with how to answer it, stick to it and stay the course. Do not stray outside of what you know, especially when it comes to how to answer certain questions. The answer is in the question. All you have to do is pay attention to it, read properly, slow down and read for understanding, especially when it comes to couples questions. You want to make sure that when you are looking at those answer responses, that answer response is going to include the couple and not just a single person. We are systemic therapists. We work systemically. We think systemically. Alrighty, everyone, this concludes everything about couples therapy and how to answer these questions. If you have any questions, comments, or concerns, always feel free to reach out to me and I will be for sure to respond. Enjoy the rest of your afternoon.